Yeah, my name is Heine. I'm a consultant psychiatrist and editor of Global Psychiatry Archives. And I just want to give some overview about the papers we published. This is a paper by OKOLOBA, and it's a pilot study on the lived experience and mental health from the COVID pandemic. So this is a sample of 91 respondents. I go to the description of the respondents. As I say, usually most of the information should be in this tables. So what you can see is male, females, more females than males, good high school education. Christianity is the most common religion. Many people unemployed and unemployed, more employed, and then from different countries, which is the sense of this study. So what you can find is that, so general anxiety, so you have people have a good, the scale is a quite good scale. But what you can see is that, that plenty of people score relatively high on the general anxiety scale. So that's, when you see here, 2021 is clearly evidence of anxiety. So it seems that the COVID pandemic causes anxiety. There's also quite a few people who have a high depression score. So that's, higher depression scores, but many people are unaffected. So depression is a major impact. This is a score where people have been saying whether they're affected in their lives. So 33% or 36% are not affected in their lives by the COVID pandemic, but quite a few people are. People estimate their knowledge quite well. So 64% think they have high knowledge, and usually it comes from video, from TV news and academic papers. So qualitative results are quite interesting. They're more or less 5 factors or 5 themes. Changes in lifestyle. So one German woman says, because of the pandemic, I rarely leave the house and have only met around 3 friends during the last weeks. Other people say experience of confinement, more working from home, holiday cancellations. So that's changes in lifestyle. That's very common. The impact on health services, so that the access to general health service are disrupted. Disruption of school, assessment. I've schooled from home now. I cannot get outside. My school exam have all been cancelled. That's an 18-year-old female from Nigeria. Or disruption of work and the economy. That's another theme. And the other thing is, the last theme is more or less anxiety. That people feel more anxious and irritated, frustrated. So it seems that, this seems to be a study which would be doable. And even though it's not a very large sample, it shows the most important impacts: anxiety, depression, lack of access, lack of going out, lack of access to schooling, work, and anxiety around this theme. So if you want to look at this paper properly, please go to www.globalpsychiatry.co.uk. And if you have more interest in simple overviews of acute and current research, please